So you and your son are on meds, but they're not working, they're not helping. What do we do? Here's what you gotta know. My name's Agam Dewan. I'm a board certified psychiatrist, and so it's my job to help moms and their sons be able to get the right treatment that they need. So the thing about medications is that meds aren't magic. Like, they're not gonna magically fix the issue, but if they're not working, then we want to make sure that we can get them working, because the right med can make all the difference. So for example, I remember I had this kid. He was a 13-year-old male, and he had a lot of trouble with like focusing. He was very impulsive. He would always walk around a lot. He would get angry a lot too. Like, small things would set him off. Like, he'd be like nice and pleasant for the most part, and then like some like small thing would happen, and then he would escalate. And so, the teachers had the issue. Like, for example, at home they had an issue when mom was trying to get him to decrease his video game use. And what we did was, so he was on a stimulant, and sometimes I found that stimulants are really useful for the right person, for like on ADHD, but for some kids and adults it can make them irritated. So what we did was we switched him over to a med called guanfacine. Guanfacine is what we call a sympatholytic. Basically, it decreases the fight or flight response, and it's a very calming medication. It's used in ADHD a lot. Typically it's meant for blood pressure, but they found that there's ADHD benefits with it. So the kid was switched to guanfacine, and within a month, just 1 or 2 milligrams, the mom says, like, wow, like, my son is completely different now. Like, he's a completely different person. So I was like, wow, like, this is so amazing to see. She says, yeah, the teachers don't complain. Even at home, I notice he's calmer. If I ask him to do something, he'll do it without complaining. Video game time has been reduced. So just that medication shift alone made a huge difference. So there's a few common reasons why ADHD meds or anxiety meds don't work. The first one, and this is the one that I see most often, is that we're just using the low dose of it. I see this a lot with anxiety meds like antidepressants. So for example, like, kid will come in, like, let's say a 16-year-old, he's got anxiety, and mom's like, okay, so we tried an antidepressant but it didn't work. And then I'll ask, okay, what was the dose and what was the antidepressant? And she'll say something like Lexapro 5 milligrams. Well, I'm like, that's a very starting dose, right? The Lexapro tends to go up to 20 milligrams. 5 milligrams, you may not even notice as much of a benefit as you need to. So we got to make sure that the dose is adequate for treatment. I find this a lot with a med called Strattera. So Strattera is a non-stimulant ADHD one, and at low doses it tends not to be as effective, like 18 milligrams or 40 milligrams. I find most of its benefits come around 80 milligrams. So having Strattera at a higher dose makes a big difference there too. So the dose can't be too high either, because then you can have side effects. Like stimulants, for example, if started too high, can cause heart palpitations, severe appetite loss, right? So sometimes even just lowering the dose can still get a good benefit without having that side effect. So the other thing is that the patient might be on the wrong type of medication. So it's not like you just go on a med and then it's going to fix it, right? Like, different meds target different neurotransmitter systems. For example, Strattera, atomoxetine, targets norepinephrine, whereas sertraline targets serotonin, whereas a medication like Adderall targets dopamine. So you see, because they all target different med receptors, they have different effects. So that's why giving a anxious kid something that might jack up their dopamine might not be the best move. Or giving a kid with low energy depression and SSRI sometimes results in the kid getting even more flat affected, because serotonin is very calming, right? So that's where the good knowledge of pharmacology really comes in from a psychiatrist like myself. And the last thing is that there's underlying issues. So if the underlying issues aren't corrected, like, meds can only go so far. So I remember I had a 35-year-old lawyer patient, and he started a big intense job, and where he was working a lot and not sleeping as much. And he was saying, well, I noticed that my Adderall doesn't seem to be working as well. However, when he slept well, he said that, wow, like, I noticed that it works way better on the days that you sleep. And so it's because the Adderall now has less to compensate for, because you're recharging your battery with sleep. It's like trying to run stuff on your phone at 20% versus at 80%. Like, that's the difference. The charger has to charge less. So, but yeah, the underlying issues are very important as well. And something that can happen is that doctors often miss asking about this stuff. So they might not ask about lifestyle, sleep, or stress, for example, right? If you have increased stress, it makes it harder for the medication. The medication has to work more. If there's other conditions like, severe, let's say you're treating ADHD and there's severe anxiety, then that can worsen things because then now we have to treat the anxiety as well. If there's sensory issues, if there's mood issues, side effects, right? Like sometimes people might not just even ask about side effects, or like you might have a headache and you think it's from something else when it could be medication related. And metabolism differences too. So that's where genetic testing comes into play, because from that we see that some meds require a higher dose, and basically because and adults will metabolize them faster, and then other meds require a lower dose than average because those kids will metabolize them slower, or they might have different receptor interactions where they might bind to a receptor better or worse. So that can make a difference too, and that's often something not accounted for. So for example, someone who might metabolize stuff really, really strongly, the max dose of Adderall might be 60 milligrams per day. For example, I had a 50-year-old guy, and his dose of Adderall was 30 milligrams 3 times a day, which is higher than normal, and higher than the max, quote unquote. But because of his genetic testing, he metabolized Adderall very, very quickly, and he found out it wore off very quickly. So that extra dose made a huge difference for him. And so now the question becomes, right, when do we adjust your medication versus when do we switch it? The rule of thumb I usually go by is if you've noticed a benefit on the meds, then we'll adjust it, right? So let's say we start a dose and you notice some benefit. This typically happens with ADHD meds. Then we can titrate it up. But then other times, I've had cases where we try an antidepressant and we go up the dose a couple times and we don't notice anything. Then I'm like, okay, it's probably time to switch it rather than keep the same dose, because even the higher doses, you don't notice any benefit. Also, if the side effects are extreme, right? So if you have for example, like you have severe weight loss or appetite loss or significant irritability from a stimulant that doesn't go away within, let's say, a week at a low dose, then it might be worth switching. Or like an antidepressant side effect, like stomach irritability, or like I've had patients complain of skin rashes, complain of scalp picking, sexual dysfunction, right? That just doesn't go away. Then it might be worth switching to something else. And of course, if there's no improvement at all either. So that was the other thing. If we don't notice anything, then we might have to try another treatment. But lastly, the medications, they're not like a magic fix, but they can be a game changer for the right patient. So those are some reasons why it may not have worked for you. And so if you want personal help with you or your son's medications, then feel free to book a consult in my bio. And yeah, then we can start working together on that. Thank you.